I work with an organization that's called the Illinois Heart Rescue Project, which started out with a grant now 7 years ago, where the focus was to increase survival rates from out-of-hospital cardiac arrest. In the state of Illinois, our plan was to try to double the rates by 5 years. After the 5 years of the grant, we actually have continued to work on this. And again, it's almost a purely volunteer basis program. But what we do is so cardiac arrest is a very complicated illness. It strikes without warning. And really the only way that we know right now to improve survival is by acting after the person has a cardiac arrest. And what we know is those first few minutes immediately after a cardiac arrest are the most important factor in determining a person's survival. And so this is why it's really important that everyone learn how to do CPR and use an automated external defibrillator, because I can have all the state-of-the-art science in the world in my emergency department and in the hospital. But if the person arrives without having gotten good CPR in the community, then the chances of them surviving with a normal brain are pretty slim. So what we've done is, besides investing in good EMS care and good hospital care, Illinois Heart Rescue has focused a lot of efforts in training people in the community on how to do hands-only CPR and AED. And we do it using maps and identifying the communities that are at highest risk, which, if you remember the COVID map, our cardiac arrest map is not very different from that one. So we've been establishing partnerships via trainings at schools, in hospitals, community centers, health associations, cultural centers. We've also done some trainings at major league sporting events. That's been a lot of fun. We haven't been able to do that this year because of COVID. I'm hoping that next year we'll be able to pick up on that too. You could go to the next slide. And so how do you do bystander CPR? Well, so the nice thing is that one of the things that Illinois Heart Rescue has been able to accomplish is get the city of Chicago ready to provide you instructions over the phone. So if you forget anything that we tell you here, you can listen to what the dispatcher says when you call 911. What is a cardiac arrest versus what is a heart attack? So with a cardiac arrest strikes suddenly. It is an electric malfunction of the heart. So if you want to think about it, a heart attack is a problem with the pipes. So it's blocked arteries, preventing oxygen-rich blood from reaching sections of the heart, which then leads to chest pain, difficulty breathing, lightheadedness. The damage from a heart attack, it can be irreversible if it's not fixed immediately. So if a blocked artery is not reopened, then that piece of tissue that the artery provided blood flow to can die. And that irreversible damage to the heart can eventually cause a cardiac arrest. And that's why, people may say, oh, he died suddenly of a heart attack. But what really killed the person was the cardiac arrest, but the heart attack might have been what led to the cardiac arrest. Now, cardiac arrest can also happen from other causes. You don't have to have an unhealthy heart, necessarily meaning the tissue of the heart to be unhealthy or the arteries to be unhealthy. But cardiac arrest can be caused sometimes by medications. It can be caused by other electrical malfunctions. So people can have irregular heart rhythms that can end up going haywire and causing a cardiac arrest. And there's also a lot of other diseases that can lead to cardiac arrest. So amyloid and other tissue diseases that can mess up, the bottom line is just messing up the electricity of your heart, whether it's from drugs or from drugs meaning medications or drugs, right? Also, or just the intrinsic electricity of the heart that's failing, or from the tissue of the heart being injured because of a heart attack or some other structural abnormality. And again, because of that, it can happen to anyone. And so a cardiac arrest can strike someone who is 0 years old to, 100, whatever. People present with just sudden loss of consciousness, and they have no pulse. And so in this, again, those first few minutes matter. A cardiac arrest has the best chance of survival if CPR and an AED are used in the first 10 minutes. So you want to call 911 as soon as you recognize someone who's lost consciousness, and you want to be ready to do CPR. And how do you do CPR? So we could go to the next slide.
Well, we actually, who qualifies as being CPR certified in these situations?
So one, you don't have to be CPR certified to do CPR. So bystander CPR, anyone can do it. You don't have to have a certification. You just have to have 2 hands and some muscle.
All right.
And the same thing with using an AED. So an AED is an automated external defibrillator. It's a device that you've probably seen in some buildings on walls. It has these pads that you put on people's chests, and you just turn on the device and it tells you what to do, and you do not have to be certified to use it. So first step, and recognize when you see someone that is not responding to their name and are not breathing normally. And this is really key, because sometimes people right after they have a cardiac arrest may seem like they have some guppy breathing, or maybe breathing abnormally, so sound like maybe they're choking, but they're not really choking. It's just a reflex from the body. So if they don't answer to their name, then you should just assume this person is having a cardiac arrest. And so the first thing that you're going to do is, if you're alone, you're going to call 911. If you're in a public space, you're going to ask someone else to call 911 and then start CPR. Okay, and you want to make sure that you call 911, because you can't be doing CPR forever. You need that advanced cardiac life support that EMS providers can give you. And so it's very easy to do chest compressions. All you need to do is put one hand on top of the other, and then we'll show you a picture of where you position your hands. But basically, you want to look at press right on the breastbone in the middle of the chest and squeeze as hard as you can so that you are collapsing that chest in half. And you want to do that 100 times per minute. And in the meantime, while you're doing chest compressions, hopefully somebody can look for an AED for you and bring it back to use and aid in the resuscitation. So if we could go to the next slide.
We have a question. What are the advantages of being CPR certified?
Well, so the advantages of being CPR certified are that you then can do other things, right? So what I am describing for you is hands-only CPR. When you're CPR certified, you learn also how to do traditional CPR, which is with rescue breathing, which is a better form of CPR for certain populations. So for example, hands-only CPR works best in adults and adolescents. And that's because in children, oftentimes a cardiac arrest is precipitated by a respiratory arrest. So that means that they first lose their ability to breathe before their heart stops. And so what that means is that if they've lost their ability to breathe, then they need that resuscitation to increase the oxygen in their blood. Versus when someone just has a cardiac arrest, then the blood in their body is assumed to be sufficiently oxygenated so that those chest compressions will provide enough oxygen to the organs while we're waiting for their heart rate to pick up again and for advanced cardiac life support measures. So there's that. Now, having said that, if you're unsure about providing rescue breathing, hands-only CPR, any CPR is better than no CPR. So even if you have a child and you don't feel comfortable doing rescue breathing, then you should go ahead and do hands-only CPR while waiting for EMS to arrive. The other thing is that oftentimes with these first aid classes, when you're being CPR certified, you learn other things. So you might learn, for example, how to do Heimlich maneuvers. You also, you learn how to do Heimlich maneuvers, you learn how to deal with people who are drowning. So there's some additional things that go with the CPR certification. But again, regardless of whether the cardiac arrest was happened because somebody was choking, somebody was drowning, it's a child and they had a respiratory arrest first, hands-only CPR is always better than doing no CPR. And that's why it's not so important that you be CPR certified to do hands-only CPR. Okay, so let's talk about using an AED. It is very easy to use. So I like the little picture there with the automated external defibrillator. So the AED, all you have to do is turn it on and it will give you all the instructions that you need to make it work. And it'll start with as simple as, you know, place pads on patient's chest. The pads are already labeled. They have exactly where on the body they should be placed. And then it'll tell you, you know, to separate yourself for a minute while it analyzes rhythm. The defibrillator is this AED is very smart. It will tell you if a shock is indicated, and it will give you instructions to press a button so that you can provide a shock to a person who's having a cardiac arrest. If the person doesn't have a rhythm that responds to defibrillation, the AED will tell you that. They'll tell you there's no shock indicated, and it'll instruct you to continue doing CPR. I see a question on the side, am I going to get shocked? So the AED will tell you to take your hands off before you press a button to instruct it to shock. So that means that you can continue doing chest compressions while the pads are on, and then just put your hands away for the minute that it'll take to analyze the rhythm and then determine if a shock is indicated. But like I said, no shock will be delivered until you physically press a button. So as long as you don't have your hands on the person while the AED is delivering the shock, you will not get shocked. Having said that, what we've learned, and this is because there's a lot of cowboy and cowgirl physicians who do this, you can continue doing chest compressions while the AED shocks, and you won't necessarily be injured. It may just be very uncomfortable. So I don't advise it, but it is not unsafe, at least not 100%, other than, you know, just don't do it. It's uncomfortable. The AED will tell you, take hands off of the patient, pay attention to it, remove your hands while it's analyzing, and then don't let anyone touch the patient while you're pressing that button when it tells you to do so. Okay.
Okay. Is every building supposed to have an AED?
There are some rules regarding the number of people in a building, and whether an AED is required. I'm forgetting off the top of my head, but I think that any building that might house more than 200 people at a time, that is a public building, it has to have an AED. I think there's exceptions made for churches, and for other like smaller community organizations that might not have money. But the bottom line is schools, public buildings, and, you know, like gyms, for example, places where people can be active and may be at risk for having a cardiac arrest should have an AED. And that's required by law. There's another question. What would you say to someone who wants to help but is scared they may do things incorrectly or hurt the person in need? So every state has some variation of Good Samaritan laws. And so if your intent was a good intent of trying to help a person, you are protected by law. So say if you broke a rib or, you know, ended up bruising a person's lungs, but it was shown that you did that in order to try to save their life, even if someone tried to sue you, they would not be successful. And in fact, there's never been a reported case of a successful lawsuit against someone who tried to resuscitate a victim of a cardiac arrest. So you shouldn't worry about that. And plus, you should consider that if you don't do anything, the person's going to die anyway. So might as well do something, even if they end up being bruised or with a broken rib, because the alternative to that is death.
Where might you find an AED?
Where are AEDs?
Yes.
It depends. I wish there was some more consistency about this. Some places will have it by the elevators. I've seen other places put it by the fire extinguisher, which makes sense to me because they're all, rescue type of devices. But there's also places that just keep them in the main office up front. So it just all depends. I've made it a practice for me that when I arrive somewhere, I try to have some situational awareness to try to identify where AEDs are. And it's very variable. Is it safe to use in a pregnant woman? Yes. What if a person is wet? That's a very good question. So ideally, you want to move the person to a dry area and dry them out some before putting the AED on them. Not so much because it just might burn their skin. So try to dry a person as much as you can, get them out of the area, that is wet, but use an AED. In fact, one of the survivors that works with Illinois Heart Rescue was a young woman who had a cardiac arrest while she was swimming. And so she was pulled out of, she was at her swim lessons, her coach pulled her out and dried her up and put an AED on her. So as long as you dry up the person, it's okay to use it, but you want to try to avoid putting AEDs on wet skin because it could actually burn their skin. It could cause some additional current on the skin. No, do not put the pads on top of clothes. It has to be on the skin. That's an excellent question. You can do CPR with clothes on. Maybe take off bulky coats, but if a shirt is fine. But no, the AEDs have to be on the skin.
Do AEDs get old or expire?
Yes. So the batteries do, and the pads. So if you have an AED, usually they last a couple of years. So yeah, if you are in an office that has an AED, you might want to ask and check whether the battery is up to date and the pads are up to date.
And then David mentioned that most AED kits contain a razor blade to remove excessive body hair.
Yeah, well, because you want the AED directly on the skin, and let's face it, some of us are hairier than others. So if you are faced with a victim that has a lot of body hair and the pads can't stick very well, then you can use the razor blade. What I've seen other people do too, but I don't advise this because it could be very painful later. But I've seen actually people use it. All AEDs come with, generally they have 2 sets of pads. So they'll use one to rip off the skin and then use another set of pads to actually do the defibrillation. If there's a razor, don't do that. But if you don't have a razor, that is one thing that I've seen people do. So, and this is why I'm making the case for learning bystander CPR. This is how cardiac arrest has changed over time in the city of Chicago. So Illinois Heart Rescue started out as a project in 2013. Our bystander CPR rates at that time were very low, 13.6. And because of that, our survival rate was 6%. And our survival rate with good neurologic outcome. And so we measure neurologic outcome through a score called the cerebral performance category. And anywhere between 1 to 2 means that you're a person who can do your activities of daily living independently, that can carry conversations and can go back home. Don't need to have a lot of supervision. CPC of 1 is the best CPC, is you can go back to work, you're gonna have a normal life. But a CPC of 2, you might have some memory deficits, you might not be able to do your job from previous to cardiac arrest, but at least you can live with your family, you can feed yourself, you can bathe yourself, you can do a lot of simple things on your own. And so back then, our survival with that good neurologic outcome was only 3.7. Go all the way to 2019 when our bystander CPR rates have almost tripled over time. And our goal is to get it even higher than that, obviously. We want everyone to get bystander CPR, but we've already increased a lot. And if you see here, our overall survival is now 13%. And our survival with good neurologic outcome is up to 11%. And so this is all because of people like you who learned how to do bystander CPR and who were willing to step up when they saw an emergency. Just for comparison purposes, I often say that my goal is to someday be like Seattle. In Seattle, the bystander CPR rates are 60%. And their survival from out of hospital cardiac arrest is somewhere in the realm of 20%. So that's where I want to go to. We have a little bit of work to do. So let's see, is there a certain population that suffer more from cardiac arrest? Sure, there's an age dependency. And again, it has to do with etiologies of cardiac arrest. What causes a cardiac arrest? The most common cause of a cardiac arrest is a heart attack. And your risk of having a heart attack increases over the years. So, so that's one thing. There's also, the more comorbid illnesses you have, whether diabetes, high blood pressure, kidney disease, all of those are things that can mess up the electricity of your heart. So for populations that have high rates of comorbid illnesses, they're also at a higher risk of having a cardiac arrest. And so if you, again, going back to our maps, all of these chronic conditions also put you at risk for having a cardiac arrest, also put you at risk for getting sick from COVID. All of those maps are superimposed. And if you look at the map of the city of Chicago and the state of Illinois, yes, there are certain pockets of the population that have higher numbers of cardiac arrest. So please follow us. We also have social media, Facebook, Instagram, YouTube. The YouTube channel has a lot of videos, short videos where you can learn how to do bystander CPR, and you can teach your friends and family members on how to do CPR.